Dr. Esma, today we're diving straight into something everyone whispers about, but almost nobody fully understands: full mouth dental implants. And let me just say, the real story is way more surprising than people expect. You told me earlier there's one specific misconception that keeps people scared for years, and I'm itching to get to it. But first, let's tease them a little, because what actually happens on day one is nothing like the horror stories online.
Exactly, Rasim. People imagine chaos, pain, and endless procedures, but the truth flips their expectations completely. And there's a moment during the consultation that shocks almost every patient. Keep watching, because that moment changes everything.
Dr. Esma, every week I hear the same stories: people avoiding photos, covering their mouths when they laugh, even skipping dinners with friends because they're embarrassed about their teeth. And it's wild how often they say, "I thought it was too late for me," but you always tell me there's a deeper problem hiding underneath the missing teeth themselves.
Absolutely, Rasim. Most people think the problem is just appearance, but the real issue is how missing teeth silently reshape the entire face. Cheeks collapse, the jaw shrinks, and people start feeling older than they actually are. And here's the part they never expect: this transformation begins far earlier than they imagine.
Dr. Esma, what really hits people is when they realize this isn't just a teeth thing. It's about confidence, energy, even how they show up in daily life. I had someone tell me they stopped speaking up in meetings because they were worried someone would notice their smile. And another person said they avoided eating around others because chewing felt like a gamble. These small moments stack up and change a person.
Exactly, Rasim. I had a patient who wouldn't even look in the mirror anymore. After full mouth implants, they walked back into the clinic looking 10 years younger, not because of makeup or lighting, but because structure was restored. And that's the key point most people miss. Restoring teeth also restores the face, the bite, and the confidence people thought they lost forever.
Dr. Esma, something you once told me blew my mind. Most people don't realize that losing multiple teeth can trigger bone loss at a pace far faster than aging itself. And when that happens, it doesn't just change how someone looks, it changes how they chew, speak, and even sleep. You had a patient who thought their jaw pain was from stress, but it turned out to be a collapse caused by missing molars.
Exactly, Rasim. That patient came in barely able to enjoy soft foods, and within weeks of placing implants, their bite strength improved dramatically. It's a perfect example of how implants don't just replace teeth, they stabilize the entire system. And the fascinating part is this: once implants stimulate the bone again, the progression of bone loss essentially stops.
Dr. Esma, here's what fascinates me. Implants aren't just mechanical replacements. They actually behave like living anchors once the body accepts them. I read that titanium forms a direct bond with bone, something called osseointegration. But the part people don't realize is how stable that connection becomes over time. It's almost like the bone says, "Okay, you're part of the team now."
Exactly, Rasim. Titanium is biocompatible, so the body treats it as a safe material. Once it integrates, the forces of chewing actually help strengthen that connection. And here's a detail most people never hear. A properly integrated implant can handle bite forces very close to natural teeth. That's why full mouth implant cases feel stable, not artificial.
Dr. Esma, people love clarity, so let's break this down step by step. When someone walks into your clinic asking about full mouth implants, what actually happens first? Because online, it looks like a maze of scans, molds, and mystery steps, but I know your workflow is surprisingly simple and structured.
It really is, Rasim. Step 1 is a detailed 3D scan. This tells us bone levels, nerve positions, and the safest spots for implants. Step 2 is planning. We design the entire new bite digitally so patients see their future smile before anything begins. And step 3 is placement day, which most people are shocked to learn is far smoother than they imagine. The digital plan guides every movement.
Dr. Esma, before anyone jumps into full mouth implants, there are a few must-know cautions. People often think, if I find a clinic that promises everything in one day, I'm set. But you've told me more than once that rushing can cause long-term issues. What are the big do's and don'ts patients should keep in mind?
Great point, Rasim. First, do choose a clinic that uses detailed 3D imaging. Don't trust places that skip proper diagnostics. Second, do ask who performs the surgery. Experience matters. Don't assume every implant brand or technique is the same. And finally, do allow proper healing time. Don't push for unrealistic timelines. These decisions shape not only the success of the implants, but the health of the entire jaw.